The WHO Global Tuberculosis Report 2023. The World Health Organization has released the Global Tuberculosis Report 2023, highlighting a comprehensive and up-to-date assessment of the TB epidemic and of progress in prevention, diagnosis, and treatment of the disease at global, regional, and country levels. What is tuberculosis? TB is caused by bacteria, Mycobacterium tuberculosis. It can be pulmonary, which affects the lungs, or extrapulmonary TB, which occurs in organ systems other than the lungs. TB is spread through the air when people with lung TB cough, sneeze, or spit. A person needs to inhale only a few germs to become infected. Symptoms of TB include cough, sometimes blood tinged, weight loss, night sweats, fever, chest pain, and fatigue. Sometimes infections show no symptoms, which is also known as latent tuberculosis. People with latent TB do not spread the disease. Every year, 10 million people fall ill with tuberculosis. Despite being a preventable and curable disease, 1.5 million people die from TB each year, making it the world's top infectious killer. TB is the leading cause of death of people with HIV because of their weakened immune systems and also a major contributor to antimicrobial resistance. WHO's End TB Strategy. It was adopted in 2014 with the aim to end the TB epidemic globally by 2035. It aims at 95% reduction by 2035 in the number of TB deaths compared with 2015, 90% reduction by 2035 in the TB incidence rate compared with 2015, and zero TB affected families facing catastrophic costs due to TB by 2035. Prevention of TB. It involves screening those at high risk, early detection and treatment of cases, and vaccination with Bacillus Calumet-Guerin (BCG) vaccine. Treatment of TB requires the use of multiple antibiotics over a long period of time. Key findings of the Global Report TB Report 2023. It was the world's second leading cause of death from a single infectious agent in 2022, following COVID 19. Across 192 countries and areas, the report reveals that 7.5 million people were diagnosed with TB in 2022, marking the highest figure recorded since WHO began global TB monitoring in 1995. TB caused almost twice as many deaths as HIV or AIDS. 30 high-burden TB countries collectively accounted for 87% of the world's TB cases in 2022. Among the top 8 high-burden countries, in addition to India, are Indonesia, China, the Philippines, Pakistan, Nigeria, Bangladesh, and the Democratic Republic of Congo. India accounted for the highest number of TB cases in the world in 2022, with 2.8 million TB cases, representing 27% of the global burden. Without treatment, the death rate from TB disease is high at about 50%. However, with the treatments currently recommended by WHO, a 4 to 6 months course of anti-TB drugs, about 85% of people with TB can be cured. The status of TB in India 2023. India recorded 28.2 lakh TB cases in 2022. Fatality ratio was found to be 12%. The best estimate of the number of deaths in India from TB was 3,42,000, out of which 3,31,000 among HIV negative people and 11,000 among those with HIV. The report highlights that multi-drug resistant TB remains a public health crisis with 1.1 lakh cases recorded in India in 2022. India has made tremendous progress in improving the case detection and reversed the impact of COVID-19 on the TB program. The treatment coverage has improved to 80%. India's efforts have resulted in reduction of TB incidences by 16% in 2022. The mortality of TB has also reduced by 18%. Recommendations of the report. The universal health coverage is essential to ensure that all people who need treatment for TB disease or infection can access these treatments. Addressing the co-epidemics of TB and HIV is a necessity. Increasing access to early and accurate diagnosis, augmenting TB finance. There was a decline in global funding available on essential TB services from 6.5 billion US dollars in 2019 to 5.8 billion US dollars in 2022, which is less than half of the global target.